I'm gonna try putting this here for this one. This, like right behind. Let's try that. Let's try that for today, huh? Is this one more? How's that? That's pretty good, right? That's a lot better with the light over here. All right, guys. TikTok live number 82 we're at now, right? First question was asked in the chat. Real quick, by the way, giving a shout out to Dr. Wahan. Dr. Wahan experiment, the Wahan experiment. This is Serv. He's part of the Back Teeth Boys, the podcast at Back Teeth Boys episodes. And he sent out shirts. So I'm represented today. If you can see. I'm recording this in the background, so I got to show. All right, guys, let's get into it. Donis Rach said, hey, tips for extracting root canal treat molar roots. I feel like they break it. Yeah, I know. My chair's super squeaky. It's ridiculous. But tips for extracting root canal treated molar roots. I feel like they break in a million pieces every time. They certainly do break into pieces every single time. A couple things that you can do. What I've been doing, dude, I've just been going right to the drill. Like, just go right to the drill. I mean, obviously try the cow horn, right? As soon as it starts to break down, just section the roots right down the middle. Know where the nerve is. Make sure the nerve's not near the apices. Just section it down the middle while you still have that much, root structure. And then you could even make a little buccal trough on one of them, and maybe use once you get the mesial comes out, right? You do a little buccal interseptal, remove that, maybe a little buccal trough, and then get that one out. And then you could use the crane pick to hit the distal root and get it up from there. So that's what I've been doing. But yeah, some of them are so ankylosed, they just keep breaking down, those brittle root canal treated teeth. And the 90-year-old M said, how do you feel about GPs placing implants? I placed thousands as a GP, zygos, pterygoids. Wow. Well, what happens when you have a complication with the zygomatic implant? What do you do there? What happens when you have a complication in the posterior with a pterygoid implant? What do you do? How do you manage that? What happens if the patient has to go to the hospital? Who are you calling? Are you going to do that work, or is that someone else going to do that work? And unfortunately, like, think about it. Who calls that work? At least in oral surgery, it's like, we manage the complications. Maybe you do manage the complications. Maybe there's something I don't know about. That's the only thing. But like, placing implants is a different thing. When you're doing such invasive surgery such as zygomatic implants or other procedures as a general dentist, you got to be able to manage those things. And it's the same thing as an oral surgeon. If I'm going to do anything, I need to be able to manage those complications, right? M said, do you feel future of OS private practice is not good? I mean, I think it's great. Oral surgery is the bridge between medicine and dentistry. And I think oral surgery is just fine. The one thing I would say is Dr. Hunter Dawson, he's a prosthodontist down in North Carolina. He was telling me on the podcast how the trend for business is for these DSOs. Let's be honest, they're buying up dental schools now. They're just turning out general dentists. That's the whole point. And they want to place those general dentists into their own practices, not private practices, their DSO practices. And then they send them to CE courses around the world even to get experience in those procedures that aren't covered by insurance plans, which maximizes the profits. And now profiting is good. I'm a big believer in capitalism. I mean, just look at North Korea versus South Korea. Which one in 50 years of communism of North Korea, which one succeeds now? Have you guys ever seen that light map? At night, North Korea is all dark at night, and South Korea has lights on. That's capitalism, okay? So that's not the point. But I think it's a bit unethical what the DSOs are doing. It's conflict of interest to buy dental schools, which is what they're doing now. Insurance companies too, and just churning out dentists to serve their purpose. Not good. So, future of OS private practice should be just fine. But as far as that all this other stuff that I'm talking about, not good, not ethical. But let's see what the 88 does about it, right? Michael said, "How's it going, doctor?" What's up, Mike? Goober said, what's your favorite fruit? Favorite fruit? Apples are nice. I usually eat a banana every morning for a late morning snack. In the office, I'll have a banana. That's just quick and easy. You know what I mean? Got to get the organic ones. Make sure you don't buy fruits with the 4s in the front. You don't want to get those there. There's a lot of stuff out there that they're not healthy. The pesticides they use and how they cultivate them, how they harvest them, how they grow them and stuff, not good. But organic and the ones with the 9 in the front are the ones I buy as far as the bananas go. But yeah, I mean, grapes are good. I love grape juice. Grape drink, but so those are some of my favorite fruits. Tomatoes are a fruit, right? I've been liking tomatoes more and more. I didn't like tomatoes as a kid. Now I like them. M said even PNWMS said it's looking bleak. When did he say that, and where did he say that? I'm curious. I know him. Pacific Northwest. GMFFL. If you had gone the MD route, which specialty would you have preferred? I would not have gone the MD route. No. Which specialty? I don't know. Maybe anesthesia. Dermatology is good. Got a great lifestyle, but that's not that's not the lifestyle I would want to live. Maybe anesthesia or maybe orthopedic surgery. But orthopedic surgery, the life isn't that great either. Either ortho or anesthesia. That's probably what I would say. Yeah, or radiology. Maybe it's cool because it's gone remote. It's gone much more remote. However, they're going to be feeling a squeeze with AI, really getting into the healthcare space. Mo the baker said, you probably don't know, but will dental schools accept my online prerequisites? I don't know. I'm sorry about that, man. I don't know, Mo. Kayer Vanam said, you said in TikTok you don't need to be board certified to practice as an OMFS. How is that possible? Yeah, because board certification is different. You could graduate from an oral surgery residency, which I did. I'm practicing oral surgery. I'm not board certified yet because I haven't taken the test yet. There's two parts. I took the first part, but that qualifies you for the second part, like the real exam. And you don't take that until 1 or 2 years out, the earliest. But you practice. Do you see what I'm saying? You need to graduate from an accredited residency program in order to practice oral surgery, but you don't need a board to be board certified. That's just another level of oral surgeon. It's not even another level, right? Because you have excellent oral surgeons that aren't board certified. That has nothing to do with that. It's just a separate thing, Karen. Al Fofana said, do you think med student could survive dental school? I think so. Yeah, I think so. M said, I handle them. Why the hospital? You handle all the complications. What happens when it goes into the orbit? Do you still handle it there? And let me know what Pacific Northwest said. Haas said, where did you graduate, Doc? Where are you based? I'm based on Long Island, New York. The office I work at is in Melville, and I graduated from NYU oral surgery residency. Let's see, next. Upanesh Chenni said, how hard is it to find a job after graduating dental school or OMFS residency? I don't know about after dental school because I went to residency. I didn't look for jobs after dental school. After residency, I mean, I've been looking. Finding a job it's not challenging to find a job, but finding the right job is very challenging. Okay, and that's for any dentist. You need to find the right opportunity for you, and certain states have different opportunities available to them. That's really what it's going to come down to. The location of the country. That's really what it's going to come down to. Makiba said, how do you build a patient? Where is it? How do you build a patient load? What? What do you mean? Owl said, Bulls said, how long did it take you to study for the CBSE? What were your hours like every day? It took a long time to study for that CBSE. I would say 3 to 5 months. You need to study hard for that. I was getting up at 5:30. I would study from 6 to 7, and then I would go into dental school from 8 to 10. We had didactics, so I would review the morning block that I did at that time. And then clinic was from 10 to 1. 1 to 2 was lunch. I would review the block again there. And then 2 to 5 was afternoon clinic. And then I would go to Panera Bread right from there at 5. And I would study there, doing another block or 2 or 3 blocks after that. Probably 2 blocks is more like it. Now tutor mode. So you're reviewing each question as you do it until 10:30. I would stay at Panera Bread every day. So those are weekdays. Saturdays, Sundays, I would be doing 10 to 15 hours just at Panera Bread all day long, just doing that. That's what I was going. Serena said, dental school has been curb stomping me mentally recently. LOL. Serena gets like that. It gets like that a lot. And let me tell you, you go to residency, it's even more than that. Yeah, it's a lot, Serena. I know, but hang tight, stick through it, keep going. You got this. Mo the baker said, you probably don't know, but will dental schools accept my online prerequisites? I'm sorry, Mo, I don't know. NBA All-Star said, are you worried about the future of OMFS with GPs doing more implants and extractions? No, I'm not worried about the future of OMFS. Why would I do that? There's not every extraction is going to be handled. So why are we have to look at the source of this, right? Like why are general dentists starting to do more and more specialty work? It's because the insurance coverage they don't cover enough of preventative care anymore. They're just not supporting providers doing preventative care. Just insurance, they're not reimbursing it, right? So then general dentists are going to do more of the specialty work, right? And then specialists do more of the hardest specialty work. That's how it goes. So insurance is the problem. That's what's causing the squeeze in all of healthcare, and this is how it's going in general dentistry, right? Because general dentists, you don't have to be a specialist to do certain procedures in dentistry. So anyway, that's how it's going. Jefferson S. Raskin, what's going on, Jefferson? What are your feelings on the Yomi robot? Too slow. That's what I think right now. Things are going to get a lot better when they combine it with like the software of AI with it. They're better instrumentation. I forget the thing where it's like it guides you to places, like the light on the thing. Upanesh Chenni said, can you explain how residency works? Like, you just jump into major surgery cases right away? Well, you do more like working up the cases and clinic work first, and then learning how to work up, how to do the steps, how to manage complications, how to prevent complications from happening as you work your way up in residency from intern year to second year, third year, fourth year. And then your chief year, your last year in oral surgery residency, that's when you're really doing most of the cases in the OR and stuff, the major surgeries. All right, that's kind of how it works. Naked Snake said, WAMC is an October applicant with a 420 academic average, 3.15 CGPA, and then so overall GPA, and a 3.08 science GPA, 600 shadow hours, 1,200 volunteer. Wow. Where to go? Great, cool. Sounds good. I don't know that they were just saying that. Okay. Bulls said, how competitive is it for Case Western since they've been going unmatched? They only went unmatched last year. I don't know if they went unmatched 2 years ago. It's super competitive. Case Western is super competitive. Don't think you're just going to get into Case Western because 2 of the 3 spots last year went unmatched. They ended up matching later that day, right? Like, it was just the initial email getting sent out because whoever they ranked matched to other programs. So that's how that went, right? It's very competitive. It is. It was just 1 year, right? Like, it's not a big deal. Marina said, do you have tips for an efficient elevator pitch for dental school interviews? An efficient elevator pitch? I mean, it's going to be personalized to you. It's not like you have the answer. You know what I mean? You need to find a quick elevator pitch within like 30 to 60 seconds, maybe like 60 to 90 seconds of what matters to you, what's personalized to you, right? Great Ride said dental implant or bridge. Well, it depends. Depends on a lot of factors. You know, my thing in my practice right now, I'm running into is the financial challenge with dental implants with some patients. Shamir Ahmed said, most complex procedure you have done in private practice. Complex procedure, the complex, I would say, well, one was an apicoectomy of tooth number 18, avoiding the inferior velar nerve. That was one. Another one was a guided maxillary implant case. I just did this on Friday. Last Friday, I just did this. It was a guided maxillary implant to site 4. There was tooth agenesis. Patient never had a tooth there, but the teeth were pretty much right together. It was pretty much like number 3 right up to number 6, actually, the canine. And so what we're doing is putting in a number 4. You could call it number 5 too. That's not the point. But we had to put one in site 4. And over years, the orthodontist was moving the canine more anteriorly, but the root had a little dip on it. And it was at one point, it's only 7 millimeters in between the root of the maxillary molar, the right first molar, and the canine. And so I did guided placement, got it right in there, didn't hit any of the roots. That was a very challenging case. I had to really delicately plan that, and it went very well. It did. It went very well, thank God. Covered it up, cover screw, bone grafting, close it up, and we'll do the stage 2 in 4 months or so. Bal said, do you recommend me to do boards and beyond before touching UWorld? No, I don't recommend that. You got to listen to CBSE Dissection. That's a video I put out with Axe, and we talked about why we wouldn't do boards and beyond and what we would do instead. Okay? And I talked about that. We did two stages. There's the first pass through UWorld and second pass through UWorld. There's Amboss now as well. You got to listen to CBSE Dissection, the video we put out on YouTube. All right? You'll read all about it there. All the materials, all the study strategy, the most efficient, effective, and updated version of how to study for the CBSE. User 6089 said, Yomi is awesome. I have one. All right. How long does it take you to place an implant with the Yomi versus doing it freehand? Zay Gilgius said, what's the process of going from What's the process of going from dental school to OMFS residency? The process, you apply in the end of your D3 externships, CBSE, your grades, your letters of recommendation and stuff, you apply there, and then after you graduate, you go to residency. Naked Snake says, sorry, TikTok has a character limit. UAC stands for what are my chances of getting interviewed? I think you have some good chances of getting interviewed. Yep. Upanesh Chenni said, how long are you working right now? How long? 9 to 5, Monday through Friday. And I'm hoping to get those hours adjusted to 8 to 4 so I can get a little more time out at the end of the day. But I need that in the mornings right now because I'm studying for boards in the mornings. Tomorrow I just got back from North Carolina. The boards is going well. I got to study more though. I got to try. I use this watch because it's got the chronograph, so I time things. It's got 2 timers. It's got the bezel and the chronograph. And I've been trying to get 1 hour in a day. I got up it to 2. I really got up to 2 hours a day, 5 days a week, at 10 hours a week, and that's the goal. So I'm going to start that tomorrow morning, maybe even a little bit tonight. Yeah. HUD said, do you think endo is becoming more competitive than OMFS? No, I don't think endo is more competitive than OMFS. No, they don't take like a qualifying exam. No. Naked Snake said, what are my chances, as in, what are my chances of going to dental school with those stats? I think you're going to get interviews. I think so. You got to let me know. Bella said, stupid question, but what do you think is an average CBSE score to match at case? At case, they want higher scores. I'm pretty sure. Look, a 75 is a very strong score. I would look in that range. All right. But you can't control what score you get. All you can control is how much you prepare for the exam. You know what I mean? I wouldn't get bogged down with that. I would just focus on studying. User 6089 said no problem for a Yomi. That's all I asked. I asked, how long does it take a Yomi to place the implant in with you? The whole thing from start to finish, anesthetizing the patient, like, you know what I mean? Because our implants, I'm placing it in like 15, 20 minutes to get one implant in. If it's an immediate, yeah, like 20 minutes to do the extraction, immediate. Sometimes it takes longer, right? You got to avoid certain structures. You want to have good placement. You got to find the right bone. If it's immediate, they can take longer, 45 minutes. But yeah. No one said, hi, doc, how are you? I'm good, no one. How are you? Naked Snake said, what are my pre-dent stats I'm getting? Okay, I just went into that. Naked Snake said, I'll let you know. So far, I got 0 interviews, but it's only been 2-3 weeks since I applied. Oh, you applied in October? That's a late application, man. When I applied, it was July. I submitted everything on May, but I took the DAT in July, so it really went in July. But applying in October is late, man. That's a late application. So I don't know if it's going to come down to your stats. It might come down to the application. You should get interviews. Just give it time. Give it time. User 6089 said, do the Nashville course and I'll test you. Oh, that's you? 5 minutes. I do freehand too. 5 minutes on the Yomi. Really? Really? That's pretty good. That's really good because they have the Yomi at NYU Dental School. They were showing me how to do it, and I was like, this is just, oh my god, I'd rather place freehand. I'm not going to do the Nashville course. I wasn't invited to it. I'm not going to go. That's a lot to take off from work as well. Because I did the St. Louis. I just got back from North Carolina. I'd like to, more prep the better. I really got to get some studying in. That's really what I got to get right now. Brush up on some stuff. I need to get repetitions of practicing cases and stuff. Where are we? Naked Snake said, I had to retake my DAT. Thankfully got a good one, but that's why I had to apply late. I'm scared. I understand. Your GPA could be boosted a little bit too. You got a good DAT now, but now we got to look at to see how the interviews get with that GPA. You know what I mean? We'll see. B Cape Coom said, latest someone should go to dental school. No such thing. No such thing. It's you got to figure out if that's for you, and you go. Doesn't matter. You got to eliminate age from this equation. Okay. If you know that you want to do dentistry, you go to dental school. That's it. Amanda, how was your week? What is your favorite procedure you did this past week? My favorite procedure was that one. It was the guided surgery on the top. That was my first guided surgery in private practice right now. I was so glad that it went well. Yeah, it went how we wanted it to go. The implant went right in there. Yeah, it went very well. Yeah, that was a great procedure last week because it was guided implant placement in the top to avoid the two roots, mesially and distally, tooth 6 and then 3. Because remember, I said there was 7 millimeters in between the roots at one point, so it needed to be a guided case, and it had 2 implants on the bottom: extraction of primary molars K and T, and placement in sites 2029 with immediate implants right after that. So yeah, it was a good week, and I got some great studying at the North Carolina course. User 6089, dude, you need the Nashville. Call me, dog. I got an associate that's studying for it too. Really? Well, can you send me a DM, man? Send me a DM. DM here is way too busy. Can you send me a DM on Instagram? I want to touch base with you. Like let's connect there. Goober said, you ever plan on coming to Gainesville for any games? Ooh, maybe. If my cousin's Aiden Mortar, if he gets any playing time, I'm gonna come down and watch the Florida game. Amanda said, any exciting procedures you were looking forward to this week? This week? In 2 weeks, I have a bilateral sinus augmentation with 2 implants placed to either side under IV sedation. That's going to be a big case. That's going to be a very big case. Yeah. So user 608, you got my DM on Insta. Wait, DM me again then. You got to let me know. I don't know, because on here it just says user 6089. It doesn't tell me who you are. So, okay, you send a DM on Insta? All right. I got to find it in the requests then. I'm like super behind because I had St. Louis 2 weeks ago. I had North Carolina this weekend. I gotta catch up on all my DMs. I don't know when I'm gonna do it because I'm trying to like get in more studying time. You know what I mean? But I like machines. Hey doc, how are you doing? Doing good, man. I'm doing good. I gotta get that studying in. You know how I'm doing? I gotta unwind tonight. I don't like flying on airplanes. I gotta admit, I don't like flying on airplanes. I don't know what it is. All the way up in the sky. It's not really. It's a little bit of taking off. Like what's gonna happen? It's not landing. Landing, I'm really comfortable. When we start the descent, I'm like, fine, let's get back to Earth. But when we're up in the sky and that little tin can starts to go like this, I'm like grabbing on. I'm grabbing on for things. I'm like practically grabbing the lady next to me, like help. But no, I don't like flying. I think that's the worst that I get is way up in the air and the plane just starts shaking like that. Anyway, naked snake. Most of my no, but I think in a way it's a good thing, right? Because that's the anxiety I experience with flying in an airplane. And now I know how some patients get in the dental office, right? So I can kind of I know who I'm treating. I know the patient in that respect because I know it myself. Naked Snake said, I hope that helps stand out. Most of my volunteering hours are nonprofit dental clinics and volunteered 1 to 2 a week with no pay as a dental assistant during my gap year. That's a really good thing that you did. Cindy Lou joined. What's up, Cindy? That's a really good thing you did. That's going to come great on your interviews because you're going to have something big to talk about. You know what I mean? That's a really good thing that you did. And you're going to have a lot of stories. You're going to have a lot of experiences that you're going to be able to share with the interviewer. Upanesh Chenni said, how confident are you when you go into surgery/a case? I need to get my wisdom teeth removed, so I'm scared. It depends on the surgery. It depends on, like you're saying, wisdom teeth. It depends on the wisdom teeth. It depends on where the nerve is. Did we get a CBCT before? Do we know exactly where that nerve is? What are the teeth looking like? Are they distal impactions? Do they have 3 roots in the mandible? It's how high up are the wisdom teeth in the maxilla? Generally, I feel really good about these, but yeah, just so you know. That's what it comes down to. No one said, I'm a dental student overseas. I want to come to the USA. Will do the INBDE, interest in OMFS. People say it's very hard for overseas to get into OMFS as an international student. Is it true? It can be done. Some recommended Australia, but they say the ADC is harder than the INBDE, but easier to be OMFS. Appreciate your thoughts. You got to go for it. You're going to have to repeat some years in dental school first, right? And then you could apply to oral surgery. There are plenty of oral surgery. I just, 2 guys in my practice, they were from Canada. I don't know if they moved to the United States and then applied but they're 2 of them from Canada. They went oral surgery. Yeah. John001 said, any recommendations on what to do with D1 summer if the plan is to specialize in the future? No recommendations. I got some recommendation for you. Don't study. Work, like, sure, you can work or whatever. I get it. You got to like support yourself or family and stuff. I would travel. I would try and do things that you wouldn't normally do. Look, when you get into dental school, you're going to be locked down for a long time. And then if you specialize in the future, you're going to be locked down for a very long time. You're talking 3 to 10 years between dental school and residency, right? Depending on what specialty you end up doing, because some of them are 2 to 3 years. So that would be 6 years, 4 years of dental school with 2 years of like pediatrics, up to 6 years in oral surgery. That's the longest residency. So that's 10 years. You're going to be locked down. It's going to be very hard to travel during that time. I would travel now. Spend time with your friends and family you don't normally get to see, okay? Lurk Manager said UNC. No. Lurk Manager said, give it up podcasting, not for it. Give it up podcasting is not for everyone. What? All right. Bloody Tooth Guy joined. No way. Dr. Auerbach is on the chat right now. Giving him a shout out. What's going on? Dr. Auerbach, dude, we got a plan. Yeah, you're on, man. We got a plan. This is huge. This is the first time you came on a live. So hello. We got to plan our part 3 coming up maybe November, December. We got to get this in. I'm looking at late November now. I'm booked up the next 3 or 4 weeks. So we gotta get you on. We gotta do that again. We gotta run it back. I Like Machines said, how long was residency for you and what was your specialty? Residency was 4 years. Specialty is oral maxillofacial surgery. Let's do it. Bloody Tooth said, let's do it. Let's do it. I'll send you a text one of these days. Yeah, we gotta get that in the books. I Like Machines said, how long was your user 5273? What's the future looking like for dentistry with the country's economy? I wouldn't base it on the economy. I would base it on the insurance reimbursement because they have total control pretty much in the healthcare space, and that dictate like what patients can get, like what care they can get. Some providers don't take insurance, right? But then that decreases the access to care for some patients, right? So insurance is really going to be the driver of that, not necessarily the economy, because I don't see the insurance companies basing their profit margins. Insurance companies, they're not basing off of, the increase in fees or the increase of reimbursements around the economy. They're not. They're just doing it based off their boardroom meetings. That's just how these things go. So yeah, I wouldn't base it on the economy. I would base it off of insurance trends. Naked Snake said, any advice new dental students with how our grad loans changed? Yeah, I wouldn't base your decision of dental school, of residency options based on how any changing loans programs going up, going down, they're going to go sideways. I wouldn't base your decision on your career, right? Because that's what it's going to come down to as a specialist or general dentist, whatever it may be. I wouldn't base that based on your loans. You need to base that based on how excited are you going to be going in every single day to do to do that profession. Does that make sense? That's very important. I like machines. Do you think the insurance companies is technically practicing medicine by covering certain procedures? Yeah, they're dictating what patients can or can't get by telling them who bet Annabelle joined. What's up, Annabelle? How's it going? How's hygiene school going? How are your classes? Annabelle and I, we worked at NYU Dental School. We used to do procedures. We used to do sedations, wisdom teeth, everything in there. All those. Yeah, she's one of the dental assistants that we got to work with. She was awesome, awesome. So good to see you on here. Do you think insurance? Yeah. So Naked Snake said, since Fed loans only cover half the cost now, there's going to be private loans, right? And the rates are going to be through the roof, I'm sure, right? But you can't judge your future career based off of. It's a very important number. You need to come in with a game plan, right? But that shouldn't affect your choice on what career path you're going to take. Who but Annabelle said, hey, Brendan, everything is going great. Thank you for asking. I miss you. I miss you too, Annabelle. I hope things are going well. I'm glad to hear that they are going well in hygiene school. Hopefully the Quizlets. Hopefully you found the Quizlets helpful. Naked Snake said, I definitely never pivot from dentistry. It's just crazy that we need private loans now. And things are going to change. In another 4 years, there's going to be another thing that comes up, right? Things are always going to change, but don't let that distract you from where you're going in this world, right? And that could be anything. You want to be, I just saw a video of electricians, with AI coming out, we need more electricians in the United States. You know what I mean? You can't base that off of the economy. You have to base that off of the innovation and changing technology and AIs, the software and everything, right? How that's going to be implemented in dentistry perhaps, and how that's going to change insurance. Right. So there's going to be a lot of things there. By the way, I got to sign off soon, guys, but top 5 listeners, I'm going to be giving you guys a shout out in the caption of YouTube, the podcast. I give you guys there. So I got to go get a little studying in tonight before I eat dinner. So guys, thanks for coming on. Bloody Tooth Guy, Dr. Auerbach, Annabelle, thank you so much for coming on. I love you guys. And Dr. Auerbach will plan a podcast in the future. All right, guys, TikTok Live number 82. Thanks so much. I'm signing off.